Hello and welcome. This is Pete Pavoli with AHF, AIDS Healthcare Foundation, and today we are at one of our facilities called the Broward Wellness Center. We are here today with Director Robert Parisi. Robert?
Thank you, Pete. Welcome. The Broward Wellness Center is a collaboration between the Broward County Health Department and AHF. It's the first time a nonprofit has collaborated with a county agency, and we took over all their STI testing. With that, I'm going to give you guys a quick tour of the facility. Okay, the Broward Wellness Center currently sees about 175 patients per day. Once the person enters the clinic, they will register, they'll self-register. Once the patient self-registers, they're going to come up to the front desk and they'll receive a number. And once the chart is created in the front office, an HIV intake specialist will pick up the chart and they'll start a counseling session with the patient. They'll do an HIV test, they'll talk about prevention, and they'll talk about their risk factors. They will also talk about PrEP. PrEP is 1 pill a day that prevents a patient from getting HIV. I have 6 testing rooms along here with 6 counselors and intake specialists in it. In here, the tester is going to actually perform an HIV test. It's a 1-minute test that is an antibody HIV test, so it will let you know if you have a negative result or a positive result. Okay, in the collection lab, our medical assistants are drawing blood for syphilis. They're doing a urine for chlamydia and gonorrhea. They're doing a throat swab for chlamydia and gonorrhea. The medical assistants in here also draw what's called a P24, which looks for acute HIV. It can pick up HIV within 2 weeks of exposure. Once somebody tests negative on the INSTI test, which is an antibody test, the blood draw will be done in here looking for acute HIV, which is an antibody and an antigen test. If a patient does test positive on the INSTI HIV test, they become the most important person in the clinic. Our linkage team is called. They are linked into one of AHF healthcare centers within 72 hours for long-term HIV care. At this site, I have 3 providers. The providers do PrEP initiation, they do PrEP follow-ups, they also treat patients that test positive for syphilis, chlamydia, gonorrhea. We do cryotherapy, and we also treat for TRIC. You're entering the AHF Broward Processing Lab. So another unique thing about Broward Wellness Center is that we process our own specimens. So this is our on-site processing lab. This Avid analyzer looks for acute HIV. So anybody that tests negative on the INSTI antibody test will get a blood draw and they'll be tested for acute HIV in here. This looks for the HIV antigen and the antibody. This picks up HIV within 2 weeks of exposure. On this side, we have the Cepheid analyzer. This looks for chlamydia and gonorrhea, throat, rectal, and urine. The specimens run through here in about 45 minutes. This is about an hour and a half. So patients actually can receive their results within 24 hours versus 7 days. Just to give you a recap, Broward Wellness Center is open 5 days a week, 9 hours a day, Monday through Friday, 10 to 7. We test for syphilis, chlamydia, gonorrhea, and HIV. We treat for syphilis, chlamydia, gonorrhea. We also offer what's called PEP, which is a post-exposure to HIV. And with that, I'll let Pete talk a little bit about that.
Post-exposure, PEP, P-E-P. It is best to get to us within 24 to 72 hours of the event. Okay, whatever happened, whether you've had a hard night out of drinking and you wake up and you're not sure who this is, if you've been raped, unfortunately raped, you need to get here. If you have done intravenous drug use with folks you don't know or possibly think that they may be HIV positive or have some kind of bloodborne STD, you need to get to us here, okay? So how does PEP work? PEP works by simply coming here, stating why you're here. You will do an HIV test, obviously, to make sure we're not giving you anti-HIV medication, right, if you're already positive. So once having done that and found out you are negative, we will then, the prescriber here will prescribe you Tivicay and Truvada. Tivicay and Truvada is right now a $3,400 regimen. It is for you free. It's 28 days of each medication. You will take these medications for the full 28 days. Furthermore, you will leave here with a 7-day starter pack, okay? That way you're immediately on the medication. If you are insured, this is the only time we will be using your insurance, okay, for the medication. We have copay cards from both Vive, Tivicay, manufacturers Vive, and Gilead, Truvada. We will cover the copays for these medications that we are going to give to you for free. If you are uninsured, the manufacturers have programs where that's what consent you're signing for me to use, and I will get you these medications through the manufacturer for free, okay? So post-exposure, most important, I suggest it, okay? Lastly, I'd like to go back to Robert with a couple questions. Robert, how much does all of this cost?
All our services here at Broward Wellness are free. There is no charge to the patient whatsoever, whether they have insurance or not.
So no insurance, insured, doesn't matter, you come here for your care. Robert, I'm here on vacation and I had a crazy night out and I feel like the person I was with had HIV. Can I come here for PEP?
You can come here for PEP. It doesn't matter where you're from in the country, doesn't matter where you're from in the state. You're welcome to our services.
And lastly, I am here illegally. I'm afraid to come to these kind of institutions because of fear of deportation. Can I come here?
You come here, no worries about that. We don't look at any kind of immigration or anything like that. Actually, we offer immigration services if you're going to become a citizen for our providers to sign off on your syphilis testing.
Oh, thank you. Thank you, Robert. There you have it. Ladies and gentlemen, I can't stress to you enough. We are in COVID times now, yes, hence the mask, okay, another virus. We see 175 people on average right now, okay, even during COVID times. So obviously people are partying, people are carrying on. The ideal method, right, of not getting an STD or HIV is closing your legs and closing your mouth, okay? I mean, it's common sense. We need to take that approach in life. The next one is to use these. Every time. We must wrap it up, people. This is not a joke. We see it every day here. You want to wake up, just come and watch the line go through this lobby every day. I thank you for your time. I can't stress to you enough. Please, common sense. We're going to be out there having fun, but use common sense. Thank you.